bit of an introduction, so you can start off by saying, my name is. Begin whenever you're ready. Doesn't matter who starts.
My name is Steve Koop.
My name is Lynetta Koop.
You have been a Gunderson patient since.
I have been a Gunderson patient since 1988.
All right, we're going to do that one more time. Yeah, why don't we start with you, Steve?
Okay.
Okay.
All right. And whenever you're ready.
You have been a Gunderson patient since.
I've been a Gunderson patient since sometime in the 60s. So a good 60 years.
And I've been a Gunderson patient since my husband and I moved to La Crosse in 1986. So I've been a Gunderson patient since 1986.
You have decided to support Gunderson Medical Foundation because.
That's yours.
Okay. We've decided to support Gunderson Medical Foundation because we believe in Gunderson's mission, and that is providing for the community so that our community is a healthy community. When our community is a healthy community, let's start that all over. Okay. We've decided to give to Gunderson Medical Foundation because we believe in a healthy community, and Gunderson does that by providing excellent health care for our community. And with that being said, there's no other reason why not to support Gunderson, because we're supporting the community when we're supporting Gunderson.
Tell us a little bit about your healthcare story. What stood out to you about the quality and care that you have received at Gunderson?
Do you want that one, or you want me to take it first?
I hadn't even thought about that one.
You'd want to talk about the health care that your mom received and how that was important to us?
Mm-hmm. Okay.
And then you've been the health care that you've received.
Mm-hmm.
Yeah.
Yeah, so you can just start off by saying what stood out to you about the care and the quality that you've received.
Several years back, my mom developed COPD. She had emphysema. And once Gunderson started working with her, and the pulmonary docs started looking at her symptoms and so forth, they basically gave her another 7 years over the previous treatment program that she was on. So that was important to my dad and to my brothers and I. And so my dad lived to be 94. He was a patient here. My mom lived to 71, I think.
Mm-hmm.
And then I've got myself and Lynetta. Our son is a patient here. And so, yeah, the whole family has been treated by Gunderson, and it's been extremely good service, I guess, that we've received.
You know, you hear a lot about disparities in health care, especially among racial groups and all that. And that's one thing that I can say of being a patient at Gunderson, even coming here, not being from here in 1986, 87, when I first started my medical treatment here. I never felt any disparity in health care. I always felt that the doctors here were caring and concerned. And I go back to our son, who is now been a patient here for 30 plus years. When he was diagnosed with some restricted airways many years ago, and his doctor at that time, who is still his current doctor, you know, took great care of him and assured us that everything was going to be fine. And we just always felt great. When I delivered our son here, the health care, the nurses, everyone, our doctors were just absolutely great, and you could tell that there was care and concern. We weren't just another number, another patient. We were part of the community, and we felt like they were our neighbors, and they cared. And really, a lot of the doctors have been our neighbors, and we know that they care.
What is one thing you will always remember from your care experience?
Wow. Can we say doctors' names?
Yeah.
Yeah.
Okay. My father-in-law, when he was here, he was had toward the end of his time, and his doctor at the time, Dr. Jack Udell, came in, and he sat with us, and he just told us what a great, great man my father-in-law was, how he really enjoyed taking care of him, and that, you know, he says he sees a lot of patients, tries not, you know, to get too involved with the patients. He says, but your father-in-law was an individual that I really, you know, got to know and felt great about, you know, just really hearing him talk about how the care that he was given my father-in-law, and that you could tell that if there was anything that he could have done, he would have done it. And so that's one of the things that stands out for me in that. The other thing that stands out for me is Dr. Todd Marr. He has been an excellent care provider for my husband and my son, and we couldn't ask for better care providers than we've had. And since Dr. Udell has retired, we now have 2 new primary care physicians, and one who's young one, Dr. Emily Dolan. So I'm so looking forward to the care that we will be receiving from young Dr. Dolan. What about you? Stand out.
I'd just be repeating you.
Well, you can answer the next question.
Okay.
As a patient or a family member of a patient, what Gunderson experience has had the biggest impact on you? And what do you remember most about it?
Can I ask him a question?
Mm-hmm.
Good. Remember the hospitalist that we had? Was that the hospitalist when you were not well? We had that hospitalist that came in, and she was just really, I don't remember her name, but we didn't know she was a hospitalist. She was just special care, and how she took really good care of you. You don't remember that?
I don't
one?
remember that.
Okay, then you can't talk to that
Yeah.
one. You talk what you were going to say.
We can move on.
Drawing a blank.
Question.
No, just what was the question again?
As a patient or family member of a patient, what Gunderson experience has had the biggest impact on you, and what do you remember most about it?
Yeah, the biggest impact on you, Dr. Waddell, when he told you about your back and that he could fix that.
Yeah, probably.
But you got to say it.
Okay. You ready?
I'm ready.
Yeah, I'd had back problems for a long time, and one failed surgery along the way, and then I fell and broke my back, and that made things even worse. So I was a tough case, and I was referred to Dr. Waddell here, and he took a look at my MRIs, and he said, "I can fix that." And he did. So, I mean, I've been without pain in my back now for about 3 years. That's important, yeah.
Amazing. All right, what 3 words would you use to describe the relationship you have or a family member has with your care team at Gunderson? If you can pick 3 words.
Caring, concerned, and, oh boy, they're definitely caring, they're definitely concerned. I'd say attentive, caring, and concerning. Those are the 3 words that I would say describe our care providers here at Gunderson. Yeah.
And approachable.
And approachable.
Yeah. So we've had exams out in the middle of the street.
We'll make sure to add that in.
Actually, that is not far from the truth, but you probably don't want to cut.
We know a lot of the dots.
Well, you probably want to cut that one, but to say, it's kind of funny is that I had fallen and on my hand, and I happened to see one of the docs who happens to be a friend, and at an event in the street actually, and I said, "Hey, can you take a look at my hand just to see if I need to come in or not?" So yes, they are quite approachable.
It's nice having
Yeah.
doctor friends, right? All right, next question. What do you accomplish by making a gift to the Gunderson Medical Foundation? How does it make you feel?
I think we could see the gifts that we're making to the foundation in the community. That's what's important, is that you give whatever money you're giving to the Gunderson Foundation. It just doesn't disappear in nowhere. You see it actually improving the lives of people that you may know. You see doctors and nurses and staff that are happy to see the money coming in so that they can make some of the changes that they want to make. And I think that's a lot. There's a lot of charities where you can give some money to the charity, but you'd never see the impact it has, except for perhaps through an article or something like that. But we see it actually happening in the community, and that's important to both of us.
Yeah, and the other part of that is that our donation, the gifts that we give, stays here. Stays right here in the community. It doesn't go, outside of the community. It stays here, helping to make a difference in our community.
Wonderful. And then the last question before closing remarks. How has your giving inspired others?
Well, for those who know that we are donors to Gunderson, when they ask me questions about why do you give there, we tell them, here's why we give, and it was like, oh, I never thought about that, and then they said, well, we can make a donation to that, so that I think our giving and our being a part of the Gunderson Foundation has been an inspiration for others to want to give, and it's like with anything, it's somewhat, if they see that you're doing it, a lot of times they want to be a part of it as well because they know the good that is coming from it. And they know that we're, very selective in where we give. And I think because of them knowing that our selectiveness, I guess is a word, of where we give, that they know that if we're giving to it, it must be an organization worth giving to, and they have decided to give as well. I know I've made phone calls on behalf of the foundation, or people have seen, us out, and they said, hey, I saw so-and-so, that, we sent a gift in honor of them thanks to you guys, so that's kind of nice.
Anything to add, Steve?
No.
All right. So the closing appeals, how do we, remember last time, Pete, we had them kind of read off?
Yeah.
Do you want them just to say their names? I'm Steve and Lynetta, and this is why we give to the Gunderson Medical Foundation, to kind of close it out?
He can say,
Yeah.
I'm Stephen, I'm Lynetta, and this is why we give.
Yeah.
That
Yep.
we're going to ask. The unison.
Okay.
Yeah, so let's do that. So I think the thing that we weren't clear on is if we were going to have them looking at the camera or off camera. I think I'd like to do both if we could.
Yeah.
But it just means we have to do everything
Twice.
But we'll just have this. So we're going to do two ways. We're going to have one where you're looking at Rebecca.
Okay.
And one, but just like what you said, that was perfect. So I have Steve, I'm Lynetta, and this is why we give to the Gunderson Medical Foundation.
Medical Foundation, okay.
Yeah.
Yeah. So we'll do it first looking at Rebecca. And why don't we go with Steve
Okay.
first?
I'm Steve Coop.
And I'm Lynetta Coop. And this is why we give to the Gunderson
Gunderson
Medical Foundation.
Okay, let's do it where just one of you says the last line. Let's go, Steve. We'll have you.
Okay.
So you start, and Lynetta, and then you say, and this is why we give to the Medical Foundation.
You want me to just say the last, or?
You're
Oh,
gonna
I
say
see.
yours, Steve.
I got it. Now I'm following. Okay.
And we're looking at Rebecca?
Yeah.
Okay.
Okay. I'm Steve Coop,
And I'm Lynetta Coop.
and this is why we give to Gunderson Medical Foundation.
All right. Let's do it looking at the camera this time. Same thing. just
Okay.
like you just did. Okay.
I'm Steve Coop,
And I'm Lynetta Coop.
and this is why we give to Gunderson Medical Foundation.
Good. I think I like it looking at the camera better. So let's just do it all that way. And I'll just I'll have this one as a side shot.
Okay.
So in case we decide we want them looking off.
Then next up, we're gonna say, every day Gunderson Medical Foundation touches the lives of patients like me. Gunderson Medical Foundation, where your generosity changes lives.
Every day, Gunderson Medical Foundation touches patients like me.
And then Gunderson Medical Foundation, where your generosity changes lives.
Gunderson Medical Foundation, where your generosity changes lives.
Let's just we can do one at a time here. So, Lynetta, let's have you say, every day Gunderson Medical Foundation touches the lives of patients like me, and right to here.
And what's the other part?
We'll just do that first part.
So every day, Gunderson Medical Foundation touches patients like me.
Touches the
Okay.
lives of patients like me.
Every day, Gunderson Medical Foundation touches the lives of patients like me.
All right. Again, right here, looking right about right there.
Every day, Gunderson Medical Foundation touches the lives of patients like me.
Okay, good.
Nice.
And then,
Should we go with Steve with the Gunderson Medical Foundation?
yeah.
So Steve, you are going to say Gunderson Medical Foundation, where your generosity changes lives. Emphasis on the your, if you can.
Yep, and you can just look right here.
Gunderson Medical Foundation, where your generosity
Okay.
changes lives.
Okay.
Gunderson Medical Foundation, where your something,
Your donation,
your donation,
your generosity
your generosity
changes lives.
changes
It's hard
lives.
to remember it when you're
Okay.
looking at a camera.
Where your
Yeah.
generation, where your
Yeah.
generosity changes lives.
Yeah.
He's looking here.
I spent my whole life hiding behind cameras.
Yeah.
Gunderson Medical Foundation, where your generosity changes lives.
Gunderson Medical Foundation, where your
Generosity
generosity
changes lives.
changes lives. Okay.
Okay.
Gunderson, Gunderson,
Gunderson Lutheran, that tells you how.
yeah.
Gunderson
Okay.
Medical Foundation. Where-
Gunderson Medical Foundation, where your,
You want me to say it?
yeah,
Well,
I
let's,
think,
let's do this. This is an easy one to split up. So I
Okay.
think, why don't you say Gunderson Medical Foundation?
Okay.
And then you can say, where your generosity changes lives.
okay.
All right, and 3, 2, 1.
Gunderson Medical Foundation,
Where your generosity changes lives.
Yeah, that's perfect.
Okay.
I think that's a good way to do it too.
And then lastly, you can just say thank you for supporting Gunderson Medical Foundation.
In
Well,
unison?
Let's have each of you say it, but not together. So
Okay.
we'll take turns.
What do you want to say?
Thank you for supporting Gunderson Medical Foundation.
So Lynette, if you want to go first, 3, 2.
Thank you for supporting Gunderson Medical Foundation.
All right, and Steve.
thank you for supporting, okay. Thank you for supporting Gunderson Medical Foundation.
I'll do it again.
Okay.
Because I think you should probably do it again too.
Okay.
Yeah, we'll do it. All right, and okay.
Thank you for supporting Gunderson Medical Foundation.
All right, 1 second. And 3, 2, 1.
Thank you for supporting Gunderson Medical Foundation.
Okay.
Nice.
Was there anything that we didn't ask you guys about
That you'd wanna-
No, I
Okay.
just, I guess other than the fact to just say that it was an easy decision, I guess, for us to decide to support Gunderson Medical Foundation even prior to me being on the board there. Gunderson has been involved so heavily in the community, and in my previous job prior to retirement, you know, Gunderson was there supporting, and just seeing the difference that Gunderson Medical Foundation does make in the community made it a real easy decision for us to support Gunderson Medical Foundation, not only annually, but also we have, in our will, have decided to leave Gunderson Medical Foundation, or we've listed Gunderson Medical Foundation in our will. That tells you how much we really care about Gunderson Medical Foundation and what it does in the community.
Okay, good.
Love it.
Anything else?
That's it.
That's good.
It's a
Okay.
wrap.
All right,
You guys are great on the camera.
yeah.
Yeah.
You are.